So our topic is errorless learning and knowledge of results. The term errorless learning refers to a learning process that involves eliminating errors throughout the learning process. Eliminating errors may be achieved through a variety of means, and in the context of memory rehabilitation, this can include breaking down tasks into smaller steps or parts, providing sufficient models for the client before they perform the task, encouraging them to avoid guessing, immediately correcting the errors that they make, and carefully taking away cues or prompts throughout their learning process. So errorless learning is an intervention based on the principle that learning will occur more quickly and efficiently if the learner does not engage in a trial and error process where guessing is encouraged. So errorless learning has been successfully used with individuals who have cognitive or memory deficits due to an acquired brain injury or dementia. Interventions used in the errorless learning approach are based on different learning abilities. So it's typical for people with impairments in memory to easily remember the mistakes that they made rather than the correction of their mistakes. So the goal of errorless learning for a person is to learn the goal of errorless learning is for a person to learn something by saying or doing it rather than being told or shown by somebody else.
And the knowledge of results goes hand in hand with errorless learning. It focuses on the end of the performance, the final outcome, the goal being met or not met, and it does not really look at the process, the skills, the form, techniques. It does not focus on how you get to the result. It only cares about the results. And this can be very problematic and a safety concern for many different clients, especially those with CVA. And the populations that this intervention strategy is implemented in would be adults over 65 who have experienced strokes and are most likely left with memory deficits of some kind. And the errorless learning approach was originally developed for patients with severe anterograde amnesia who were deemed to be at particular risk for error learning and making errors throughout their process. So errorless learning has since been investigated in other memory impaired populations like Alzheimer's, acquired aphasia, and many, many more. And the settings where the intervention approach is commonly used, most of our research really focused on the inpatient rehab hospitals, but it can be implemented in outpatient neuro facilities and probably many more, but those are the two very big ones we noticed.
So there are some limitations to this intervention approach, and we'll provide the citations in our discussion board. So one of them is assuring that error elimination is genuinely errorless. It depends on what kinds of learning techniques are adopted and used. The degree to which behaviors are being taught kind of lie within the participants' repertoire and how they are. And their behaviors and all of that. The role of task complexity can be a limitation, and the influence of differing levels of motivation and effort that lie within the client. So the evidence recommended length or time of duration in errorless learning and knowledge of results can kind of vary from step-to-step completion. It can depend on how many cues that are needed and eventually decreased over time. And it just ultimately varies between the person and the severity of their stroke and CVA effects. So long-term process is kind of the general length, I guess, for this process until carryover is complete and the task is accurately understood. And then short-term is kind of just the general rule of thumb for the different parts and breaking down tasks for the individual. So evidence suggests that errorless learning offers benefits for at least some people with memory impairments when teaching certain kinds of tasks. So the evidence is strongest in relation to people with severe memory impairments following an acquired brain injury. However, not all groups did benefit in all the research that we found, so some findings are equivocal, and there are some limitations associated with this approach.
So every single client is different too. So some we noticed in our research really benefit, and then others really didn't. They would benefit from other strategies such as trial and error. And a study we found worked with clients with severe brain injuries and memory impairments, and they were asked to place objects in a computer game into random drawers. And only one object was allowed per drawer, and they were asked to remember what kind of object was in what drawer, and later asked randomly to find this object in the drawer. So those that use the errorless learning method, they had better results at recall later on than with trial and error. Trial and error kind of just randomly clicked. Errorless learning, they really, if any of their mistakes were really close to the drawer that the object was supposed to be in, so that yielded some better results with memory. And the trial and error people, like, they had guesses all over the place. So that was just something very important to note.
So we chose to use a demonstration of errorless learning by teaching someone how to use an electronic pillbox. And we also attach a link of kind of just explaining how it works. So literature focuses on how technology is used to improve daily function in those with memory loss and consistently documents improvement in specifically trained tasks such as medication management, which is what we're focusing on. So these steps are taught using errorless learning techniques, and the cues for each stage will be gradually taken away to ensure that the person maintains performance or peak performance for as long as possible. So our first step, so we would break this down into 5 different steps. The first one would be to gather the medications and sit down with the patient. We would read the labels on the box to figure out what time they needed to take their medications and what days they needed to take it on, if it was daily or as needed. So cueing would be necessary to correct any errors that the client made while they were reading the labels and just making sure that they fully understand when to take each medication. And we would want them to avoid guessing as well. So, that would just be our first step. The second step would be setting the time on the pill box. So part of errorless learning is modeling it before the client performs the task. So that would be an instance where we would probably want to show them how to set the time and just how it all works in general. And as they try to start to use it and set the timer, we would eventually start taking away cues.
And then we are on to step 3. So as the task progresses, these are broken up into smaller steps. The cueing, we try to work toward gradually giving them less and less. And they move on to the next step only after they've have a pretty good handle on the previous step. So that's where the knowledge of results also comes in. So step 3 is actually sorting the pills into the box, and cueing may be necessary to correct any errors and make sure that they correctly understand, because medication management is extremely important. And it's also, cueing would be mostly to help encourage self-correction. And modeling may be necessary here too, as you explain it. And then on to step 4 is you will continue until all medications are in pill boxes, or even refilling after they have taken the pills. And there is more time offered as well as we progress through these steps to allow for them to kind of self-correct themselves and not make these errors and really think about it to avoid the guessing. And obviously fewer cues. And then step 5, our last step, is we really educate them on how to specifically use this electronic pill box. Before we're really kind of just working on the sorting and stuff, this is where the actual technology would come into play. And then we would have them try and correct any mistakes immediately. Not really any modeling here, only cues to help promote the self-correction and just make sure they understand the educational materials. And then our references will be attached in the discussion board, and link will be provided and everything for our actual demo. We do not have access to the electronic pill box.